the general theme of the conversation, and we're going to talk about kind of all the backstory here and the whys and the wherefores and how it all works. But essentially, what this chat with you, Rob, what we would like to be able to explain to the guys watching is the role that we can play as a sector in rehabilitating people who've had COVID-19 or long COVID, why anybody would want to do that, how easy it is to do, and if you want to do it, how you can get involved. Yeah. And pretty much verbatim, End of May went to UCAT and said, we've had this idea, if it's shit, throw a bucket of cold water over us and tell us, we're full of nonsense. But if it's going to be value to people, we'll get behind it, we'll personally fund it, and we'll make it happen. So went to UK Active, and we explained that we'd got the content and means to be able to provide a training program for trainers and coaches to be able to get hands-on and rehabilitate someone from COVID or long COVID past their acute phase. So as Col says, once they've been discharged from hospital or their initial symptoms have started to, for want of a better word, Col, subside.
Yeah.
So that key group, but without wanting to take us down another path, the other key groups that we talked about with UK Active, because we will come on to these a little bit later, was also the whole population of people that are already gym members that have been stuck at home with one dumbbell for arguably in some cases since March. Do I really want to keep my gym membership? Do I really want to pay for personal training? Oh, when I get back in the gym, I want to get back to deadlifting 200 Ks and get back to where I was, and kind of all that expectation piece. So there was a whole other population that we thought to address. And then the third population was around, as Col said before when we were just chatting, that group that's classed as vulnerable during the COVID-19 period. So anybody that may come under categories like those individuals that are dealing with cancer or diabetes or cardiovascular disease, cystic fibrosis, etc. That whole group has had to shelter more than anyone else, as well as, pregnant ladies, etc. But they've had to shelter so much during this period. And for a lot of those guys, they don't want to be the group that has to shelter a second time around. So they're coming through our doors. It's already started, and World Health have issued data that says that we should expect more of those groups to come through our doors. So with that population in mind, we also wanted to put some content together that would help best prepare clubs and coaches to receive those people and be able to greet them with the information they needed when they came through the door. So those are the three populations that we spoke to UK Active about. I said we've got some content, we can package it up into these courses that's going to make sense for clubs and coaches. But really the COVID course has sort of, this isn't the right word for it because of the nature of what something like COVID is, which is obviously a very brutal virus, but the COVID course Rebuild has become our sort of flagship, really. And that's what Col and I have been spending a lot of time talking about, presenting on, we're being asked about, we're already working with clubs on. So that's the main topic of conversation for us today.
Yeah, it makes perfect sense because it's just so relevant, isn't it, at the moment with COVID still being rife. But there's a lot of people coming out the other end of it that need the support to rebuild, literally rehabilitation.
Yeah. Well, on that note, the vast majority of people are going to have no type of medical intervention. Probably won't even see a GP because what will happen in the best instance, they'll be symptomatic. They'll be able to access a test, have their COVID-19 condition confirmed, ride out their symptoms, and then go, right, what happens now? That's the vast majority of people. And sometimes what we get kind of embroiled in, because of the nature of the people we speak to, are conversations about someone who's been on ITU and that level of interference and deconditioning and comorbidities and secondary causes. And don't get me wrong, we're mindful of that and it features within the program. But the vast majority of people and the vast majority of people that our coaches are going to work with aren't that. And they're also the biggest group who, believe it or not, at some point are going to recognise that they need help.
To provide a little bit of assurances as well, I guess, because we do get asked this this question a little bit, just at the front end. So since that very initial conversation with UK Active, when we'd said, look, is this worthwhile doing, this is going to help people, UK Active have been nothing short of encouraging and supporting since May. We're now a strategic partner with those guys and working closely on how we can collaborate as two organisations to make the course more accessible to more clubs and coaches. And also, again, we'll come on to this later, but this highlights all the more, really. And this has only massively become apparent in the last few weeks, really. But this highlights all the more that if we as a sector, if our club infrastructure is the resource for rehabilitation for people who've had COVID, it's obviously all the more reason as to why we should remain open.
Yeah.
Similarly, just on the assurances piece, we're now a CIMSPA training provider, approved partner. We've, as of this week, we've also received Europe Active Lifelong Learning Programme accreditation status as well. So we're being, from the get-go, and hopefully this comes through when we're talking today, Col and I are all about collaboration and work, and hence our conversation really, and working with as many organisations throughout our sector, within the NHS, within government, with coaches, to understand better people's needs, but in the context of what we're talking about today, really just drive awareness and help a lot of the people that you and Col were just referring to there. So let's get stuck into the meat of it. First questions that we get asked, whomever we're talking to, quite often when we're talking to club owners, is how many people are we actually talking about when we talk about COVID and long COVID? Col will talk through this slide a little in a second. I'm always conscious that our faces cover this hand side here. But so that those watching know, the timeline goes up to around November 13th when the daily cases rose above 33,000. That peak has massively tapered down since lockdown 2 for obvious reasons. But a little bit like you guys were just talking to then, the daily cases have gone up massively. Currently, total cases in the UK, as of December 1st, as the slide says, was 1.63 mil. Today it was 1.66. And if you think the death rate, whilst we always say, don't we, Col, one death for anything is obviously one death too many, particularly with relation to COVID. So one death is one too many, but the current death rate is at 3.6%. And Col, globally is survival rate, what is it, 99.5 currently?
Well, globally, the survival rate ranges between 99 and 99.5% globally, which I think sometimes you have to take a moment to let the impact of that sit in, because that's considering third world countries and countries where there's less of an automatic health provision. So actually, when you look at that on scale, you know, it's a profound survival rate. Most people, the vast majority of people who are infected with COVID-19 are expected to survive. Now, what you got to bear in mind is in some instances, they are surviving because of hospital and medical care, but they are the minority. Don't get me wrong, there is a ton of people, too many people globally, certainly here in the UK and Ireland, who are at risk when, if we were to delve into that issue, shouldn't be at risk. The preventables, overweight and obesity, type 2 diabetes, certain types of cancers, lifestyle cancers, cardiovascular disease, metabolic syndrome, you know, these things that are chronic illnesses related to lifestyle, less people should be at risk. But still, the vast majority of people aren't looking or facing COVID-19 as something that is likely at all to kill them. But we've already got over 1 million people who've experienced it and are now dealing with the aftershock of it.
I've had 67 professional Muay Thai fights, former 3-time world champion and the current UK #1. So I work at various gyms around London, taking group fitness, as well as personal training individuals to teach them boxing or Muay Thai. I cycle quite a lot around London, and I'm always on my feet, walking anywhere and everywhere that I can. So I'm very, very active. So I got COVID.
I could feel my heart thudding in my chest, and I felt fatigued for 2 or 3 days afterwards. My neck I could feel my pulse in my neck. My head felt it was going to explode. And by the way, during the night, I've had this really, really weird pain in my head, and my cheek feels numb. And she just said, you've got to get an ambulance and get yourself to hospital quick, because you might be having a stroke or have had a stroke. They've said I've got some mild neurological nerve damage. If you go to a class and say, right, well, we're going to do an EMOM, every minute on the minute. I don't think my brain could actually process that as well at the moment. I'm really scared to start again, because I don't know whether it's going to trigger it off all over again. But I don't want to not start again, because I want to get back to myself. But I don't know when the right time will be to start.
For every single person who died, so who was hospitalised and died, 19 more people would require hospitalisation. Of those, 18 would have permanent heart damage for the rest of their lives. 10 would have permanent lung damage. 3 were likely to have a stroke, would have a stroke. 2 will have neurological damage that leads to chronic weakness. And another 2 will have neurological damage that leads to loss of cognitive function.
The spectrum is far ranging. People are affected at multiple different levels, but where they go to for rehabilitation at this next stage, there hasn't been a predetermined path for them yet. And our argument, our cause, is that we see the sector as being equipped and able to step in and receive those people now. As an industry, we have a club infrastructure up and down the breadth of the country that covers every single hotspot that we talked about before. And we've got a workforce in its tens of thousands that understands physiology, the human body, and can digest the context of information around COVID-19 to be able to help. Because as we said at the very beginning, which Rob is partly what prompted me to contact you, is there's these hundreds of thousands of people out there at the moment who are like Jan, Charlie and Kate, who are struggling, and because they don't know who to go to and who to ask for help, they're trying to self-prescribe themselves out of their own situation. And for the most part, because through no fault of their own, they don't have access to the right information, they don't know the right information, they're making ill-informed choices, and they're actually making themselves sicker. And this is what's creating this sort of the longevity of the long COVID, because for every 2 steps forward they think they're taking, they're actually ending up 5 steps back. Whereas what we found is if we can get a coach that understands the pathology of COVID-19 and what's required to restore them back to full health status, all they will do is actually move forward instead. So what prompted our conversation, kind of what we got stuck into last week, is how clubs, coaches, club owners can help to facilitate all of that. From your perspective though, that data we just talked through there with regards COVID-19 and long COVID, I know we've touched on some of that before, Rob, but how much of an awareness, or how much of that did you know before, or did some of that kind of new, or?
Yeah, so I've probably got the same sort of awareness and opinion as most people have, and it comes across as like the flu virus, and you have it, and unless you're hospitalized, generally you have it and it'll go, and then you get on with things. The whole long COVID and the lingering symptoms, I've never really thought about myself, and I'm not sure whether other people have either as well. So I think that's the bit for me. From the video, I was thinking, I think it was Jan you mentioned, who said she had the pain in the head and the cheeks were numb. And I was thinking, these are actually quite severe symptoms that are coming off the back of COVID that you don't hear about. You hear about hospitalizations and being on a ventilator, but you don't hear about the other bits. And I think that's kind of, it hits home when you see videos like that and you actually listen to what they're saying and the bigger risks that people have. If she was to come out and go straight back into the gym doing, she mentioned some CrossFit terms there, eat every minute on the minute, doing that sort of workout. I'm sure that would do far more damage than having the guidance of a trained professional to sort of gradually feed her back into an exercise program. So it's an eye opener for sure, for definitely.
Agreed. And Cole used the car crash analogy before. Another analogy we use quite often with people who've had COVID is it's akin to breaking your leg and then going for a run.
Yeah,
it's the same sort of thing, but because as Cole made the point earlier, because you can't see it, you think you feel better, you'll push past it. But it's the same as with anything, flu, glandular fever. If you don't give your body enough time to recover, then it doesn't get better. But it's this, but in the context of something much worse. So as we were talking about last week, whilst in the very beginning, Col and I, the conversation with UK Active, we've got an education program that helps clubs and coaches. It's sort of become much bigger than an education program now, because where we've become way more involved in this COVID world is in speaking to individuals directly who've had COVID-19, who are living with long COVID in their tens and hundreds, and listening to their different types of experiences, all different manifestations of everything that we've talked about today. And for us, it's become way bigger than an education course, and it's become more about helping those individuals to access help in their communities through our club infrastructure. So how that looks like is essentially this diagram on screen, which is kind of the best way of explaining it. So the dot in the middle, let's call it the skills registry, that's the clubs and the coaches. So our goal, our priority to facilitate what I just described is to have as many individual coaches have the knowledge and competence and the right skill set to be able to work with individuals who've endured COVID or long COVID. Now, from a coach and a club perspective, those individuals who've been affected, they could be existing members. So the first protocol is to let existing members know that we can facilitate your recovery in-house if you've been affected. Another key piece of that is this is a whole other conversation that can be had with the local community, with new individuals that may or may not have ever had a gym membership before, to let them know if they've been affected that this is their local rehabilitation resource. And actually, it's not on this slide, but referral, it's like a different level of referral as well, because we've had a lot of coaches receive referrals from people that are in their network who may not have had COVID, but a lot of people now have loved ones who have had COVID. So there's a different type of referral coming through for the newcomers as well. Bottom right, there's a whole other type of conversation that clubs and coaches can have now with their local general practitioner, primary care groups, rehab groups, to let those guys know that they're skilled up and they're well positioned to receive patients after the acute phase. Because the GPs wouldn't be able to signpost them on to someone else for help. There's a desire for that from them. So it's just opening that lines of communication.
We a bit like the GP referral kind of thing for the NHS.
Yes and no, but I'm going to let Col answer that.
I mean, there's GP referral, which is a qualification in itself, and there's obviously, we were part of a panel yesterday with UK Active, which was discussing this notion of that level of investment trust that the medical sector has, NHS, GP, in the skill set and skill provision of the fitness world. And there's a lot of work that needs to be done on that. However, locally, this is where I would encourage coaches, PTs, operators, gym owners to start reaching out to their local GP, primary care, NHS, and start to say, look, this is what we've done. This is how we've upskilled our coaches, our provision, in order to work with these people at this stage. And the more of that language that a coach or a gym operator understands, and therefore can have those types of conversations with their local GP, primary care, NHS, the more confidence they're going to foster. And ultimately, everyone wants the same thing and the same outcome, and everyone needs to break bread and meet in the middle ground. And I think for now, that needs to be led by our industry. So we need to take accountability of the skill set we need to develop. And then we need to open the door and be able to say, this is what we do. This is what we've invested in our own development. And these are the kind of people that we intend to work with and support you in that longer term recovery rehabilitation. Because ultimately, you know, the NHS is fueled by a positive interpretation of negatives. The negative being you don't come back. So if I don't see you again, I assume that's because we've been successful. And a lack of re-referral is a really positive outcome for the NHS, whether it's a GP, physiotherapist, whatever it is. If I've worked with you, you go and you never come back re-referred for the same condition, brilliant. Re-referrals are low. That looks great on our statistics. The way to reduce re-referrals in this instance is for people to work effectively with exercise specialists and start to get the long-term support they need in the community. So there is groundwork to be done. That said, some areas are great. You know, here on the Wirral, through the UTS, we've done a ton of work working with our local oncology departments, GPs, and we have a good relationship now where they know that they can send people to us with confidence and that we're going to be able to look after those individuals. The first graduate of the CAWS program, straight off the bat, you know, received, if I remember rightly, correct me if I'm wrong, Mel, was it 15 people straight off the bat? Local GP was brilliant. You can do this, great. And started to plug straight in and start to work with those people. So as for the formality of that direct system of GP referral in, we're working towards that. But as an industry, as a sector, we're working towards that more across the board. But with regards to once you are confident and competent, these are the kind of conversations and bridges we're encouraging our skill sector to build and start to work in and say, look, we're here and ready to work with these people and we know what to do. Not only are we safe, you know, safe is 20% of the equation, in my opinion. We can be effective, really effective. That's the key part.
Mm-hmm. And as Col just talked about, our grad there, Chris, not only, again, because, you know, you see stuff on a slide like this and people talk about it and it's like, yeah, easier said than done. Do you know what I mean? But Chris is like a case in point of actually it can be that simple. There was no resistance from his GP. It was a really open conversation. And then similarly, where we've had conversations with people who've had COVID and then introduced them to, look, this is the level of support you could get with a rebuild coach. Not a single human being has said no, because they all want help. So it's all just a very simple process, just real kind of human to human type conversation. It's just switching the communication channels on, really. And similarly, that whole community notion, we've had schools contact us saying that their students have been affected by COVID. Is there any COVID rebuild coaches local to them that can come in and help with the students' recovery? And then same from an employer's perspective. Like as an industry and, you know, as clubs, I remember back when I used to do corporate outreach in the streets of Sunnystoke-on-Trent, and, you know, we've been banging that drum forevermore, but this is an entirely new type of corporate outreach style conversation we can have. Jan in the video, she, bless her, she won't mind me sharing, you know, she at times still struggles with emails. The commute to work will take it out of her for a couple of days, you know, the day she goes in. And there are literally hundreds of people in these groups that we're in who are worrying about getting fired. And meanwhile, their bosses have got people out on long-term sick, which is a whole challenge for them. And then you've got the whole human element of, you know, you want to support your staff who've been affected by the pandemic. So these doors that before were a little bit harder to knock on, everyone is now generally, we were talking about this the other day, weren't we, Rob? Like everyone's generally more receptive to helping one another. And it's really easy to switch on. And it's as we said at the front end of this call, it's like the current way of restating our position as a sector and our role as club operators and club owners in the centre of our communities as being a resource for help and support and knowledge.
Yeah, I agree. So for me, straight away I'm thinking, my background's commercial, and I'm straight away thinking, how do we how do the independent facilities take advantage of this sort of thing? The obvious thing for me is GP referrals historically tend to be pointed towards leisure centres because they probably haven't had the contacts. Or they're deemed to be the trusted resource for a GP referral program. Private facilities generally haven't, but for something like this, if independent facilities can get on board with the CAWS program and the rebuild program, they can get ahead of the game and jump ahead of those facilities with the credibility to go to a doctor and say, we're trained and we're ready to go. Let us help you guys out. So I think there's a potential here to position the industry in a much more credible manner than we perhaps perceived in the run up to this, if that makes sense.
And a little bit like what you're saying there, Rob, if I'm a member of UTS and I need support and rehabilitation, whatever I've been through, I would like to get that at UTS, right? If I am a member of the leisure centre, then I want to get my support there. And if I'm a member of CrossFit Stoke, then I'd like to get my support there. So if we can, empower all of these different locations to be able to help individuals in all these different contexts so that, people can go through some of their toughest struggles and also some of their highs in the community that they choose, then that's a big part of our goal.
Yeah, definitely. I think we had a similar conversation, didn't we, about a centre down in the southwest where a couple of their members had been GP referral back to a leisure centre for treatment, but they wanted to stay in their gym. It's like, let's give these guys the tools to keep their members in the gym for the COVID, sort of long COVID sort of rebuild sort of type work. So,
but very often we're asked key questions like, okay, what does it look like? What does it involve? So I thought it might make sense just to address kind of some of those frequently asked questions, really. So the course is all delivered online, 61 videos in there, and they range from being some are less than a minute in length. There's a handful that are up to an hour. On average, most of the videos last around 20-23 minutes. There is a live Q&A tutorial midway to 3/4 of the way through the course, which the guys can dial into, throw a ton of questions directly to Col about the course content, or if they're then already working hands-on with clients, they can come back and join the live Q&A to talk about any particular client questions or any real complex scenarios. The rebuild course does have an assessment at the end, which is a 30-question multiple choice question assessment. And the guys have 20 minutes to tackle that assessment. They have to achieve a pass mark of 75%. And then as soon as they do, they're considered a certified rebuild coach. They then sit on our registry of skilled graduates as well. So not only does that mean that they can then have those integrated conversations in the community, and the club can start letting all members and community members know, but then when we receive the incoming inquiries that we do from individuals who've had COVID, or schools or employers, that we can then first look at where those people are based. And then our goal is always to connect those people with the nearest club to them, first and foremost. Geographically, and definitely this course went live online first at the end of October. So geographically, we're still in that growth phase in terms of getting more good boots on the ground to help people. So there are coaches now that are working with people remotely because we don't necessarily have the geographical locations. But of course, that again was another reason why we connected Rob, because if there are club owners and operators watching this that would like to be able to facilitate rehabilitation for people in their local community, then it means we can alter that geographical spread. There's a huge human element to everything we've talked about, and I can get a bit evangelical when it comes to helping these individuals, because we're sort of at the coal face of some of the conversations. But there's obviously a ton of there's a big business part to what we've talked about as well, and when we speak with clubs, we're all very reluctant and feel a bit uncomfortable about using the word opportunity for obvious reasons, but there is some commercial elements that are part of the rehabilitation program, so it's important that we acknowledge those and everybody understands the context that we're talking about them in. So we talked about this big community aspect, our immediate member community, our local community, that's a given. We all understand that. Most of us entered this sector because we wanted to help people, so that rings loud and clear. A lot of clubs have spoken to us about getting coaches onboarded and delivering the rehabilitation program to their member audience and providing it free of charge internally as a bit of retention tool as well. A new service, you know, on the docket, that if you have suffered COVID and you're a member of ours, we've got you, we'll look after you. Of course, though, and we did talk about this before, it is a new conversation, a new message that can be spread throughout the local community to attract that newcomer audience. I've also mentioned a number of times that without doubt, this is a further reason why gyms ought to be kept open. Because if we can facilitate this level of help for people who've been affected by the pandemic, there's absolutely no sane reason why any facility should be closed. There isn't a sane that debate for another day. There isn't a reason anyway, but this obviously aids our cause. We talked about the retention call. We talked about the retention tool and clubs offering this service free of charge to members, but there is also other clubs that will deliver it as a paid rehabilitation program. But also, it's kind of, if any of the coaches go through a pre or postnatal program, or they go through a corrective exercise education program, you'd still charge for one-to-one PT small group training with that antenatal group. It's entirely the same thing. So how people attach pricing to any of those delivery methods is entirely at the club's discretion. We've talked a few times this week with clubs who traditionally don't deliver personal training on site, but naturally this is they'll have level 3 qualified staff, but potentially PT isn't a core part of their product. But if by the virtue of COVID rehabilitation, you're working more hands-on and more one-to-one with individuals, it almost facilitates a gateway for this same group of people once they come out of this restoration phase, and the likelihood is that they'll want to continue working with that individual as they return to full health and beyond. Another key question that we've had from clubs, particularly during lockdown 2, was because of the restrictions around social distancing within clubs, space is very limited. Current members are already a bit sort of frankly pissed off because they're having to book in, and you've got that whole debacle. So there was a little bit of nervousness in some instances around how many newcomers do we really want to attract at the moment, because we're already sort of compromised. At the same time, the world we're currently living in, it's not like anybody wants to be turning away, new people to work with. So we built the program with potentially second and future lockdowns in mind. And so everything that's taught in there means that it can be delivered in a gym or outdoors or remotely. So it is possible that if that is an issue for clubs, that they can deliver it remotely, like we talked about with those examples before, with an individual, to then at some point in the future, if it makes sense to evolve that way, when the restrictions are relaxed or things start to change to a new normal, that digital community is then there to be able to come into the physical gym. And as Col talked about just now, this is obviously this rebuild program is obviously heavily based on COVID, but a lot of the principles and the concepts that the guys will go through in this course are followed up by the Fortitude course, which focuses on these whole other populations that are accessible in the exact same ways that we talked about the COVID population and where those guys are at the moment.
That's interesting. I think that's really useful because COVID is obviously very current. Giving gyms and personal trainers an extra tool to, from a commercial perspective, is to bring new members in and to bring new clients on board. But the follow-on to the rebuild, I think you call it Fortitude, that gives them then, if we talk about the GP referral example, we can get in front of doctors and gain credibility with the rebuild course. once this has not gone away but being handled, we can then go, look, we've got the fortitude skills as well, brings in all the other things such as cancer, cardio disease, diabetes as well. So we're in front of the doctors to then get additional clients as well, and also others in the community that have done their 12 weeks of rehab and they're off they go, and we can help those at the same time as well. So even though it's a great tool for the current scenario, but it's a great commercial tool moving forward as well, I think.
Thanks, mate. We've tried to, we've worked really hard as well in both courses, in all courses, to deliver the content a little bit differently as well. Yeah. And I think there's still a large proportion of the coach and trainer population who are worried about their level of confidence when it comes to working with these different sorts of groups. Col mentioned this at the very front end of the conversation. So what we've massively leaned into in the courses is highlighting what you can do with these groups and how straightforward it can be, and how we don't need to overcomplicate it, and how simple it can be to address what might at first seem a complex situation. That's been the real key part of what we've tried to do, and deliver a lot of those messages in as an up-to-date and contemporary way as we can, i.e. through video content and all accessible online, and learn in the bath, learn on the go. That within reason. Obviously, filming a ton of content during COVID-19 lockdown 1 was pretty intense, but thankfully Col has a gym, so it made it a little bit easier. This is a message between her and Chris as her rebuild coach, which just kind of emphasizes everything that we talked about, i.e. for months you've got an individual who's tried to navigate her way through her long COVID scenario single-handedly and struggled. And within 10 days of having some hands-on support and the right guidance, and have someone be the limiting factor in terms of pace moving forward, the effects and the positive change that we actually can have on these people who, in their own words, are starting to lose hope and need some help and some guidance.
Awesome. So just reading through it there, it sort of shows how useful and the gratitude these guys have got coming back, haven't they? So yeah, good work.
It's always the way, it's more of a change, isn't it? I was giving a lecture this morning, and people think that the headline stuff of what I've done in my career to date is, speaking to someone who you've trained at the top of Everest, who's saying we've made it and we can see the view and we're coming down, and all that stuff's really powerful, don't get me wrong, but nowhere near as powerful as someone who's overcome their diagnosis, their prognosis. When you literally working with someone who's in the same kind of background position as you, just a person who's going about their life, and their quality of life is enhanced, and they feel like they're getting their life back, and they can pick up their kids and they can do normal stuff. That's the real stuff. I promise you, really. I'm not even trying to sound evangelical. It's true. That's the real stuff, and that's why the vast majority of people get into being a coach, a personal trainer, is to help people to improve their lives. And the tougher the fight, the sweeter the victory. So when someone's really coming from a dark place, really having to deal with real pressing issues, and you can crack the curtain and bring a bit of light into that situation and start to give them their confidence back and their quality of life back. And in this instance, their kind of hope back with regards to moving forward and beyond it, and starting to allay those fears. It's huge, isn't it? It's far more than a medal and a t-shirt and all that kind of normal stuff. It really is. And when I read this, when it came through, every single kind of message like that gives me goosebumps, because it's the real stuff, isn't it? It really is the real stuff.
As Col said then about the hope, when we spoke, and I've mentioned it before, when we spoke to people and we explain their symptoms to them and why they've experienced what they've had, we hear so many times, I thought it was just me. I thought it was just me being a bit weak. Or they may have used other term phrases. Being a bit weak. I thought I was doing something wrong. I was starting to lose hope. They're literally the words that are coming from people's mouths, and we can so easily make a difference. On Cole's point there about the medals by comparison don't compare, like you, Rob, my background's kind of early on operations, but since then more commercial side, and we talked about some of the products and brands I've worked with and stuff in the past. But so I've never really typically been hands-on with a person like a coach would, or somebody that's going through something like a COVID or dealing with cancer. So this actually is the first type of email that I'd received of this nature when this came through. And no bullshit, if we're talking real talk, I read that email and literally blarted crying. Like, just as in with like shit, like that feeling that Cole described, then we typically don't have that all that much in our line of work. So then when I talk and I say, for us, it is more than a course. It is more than a course because of all the jams of the world that we see and we speak to who are experiencing this in relation to COVID. But like in Cole's world, across all kinds of chronic conditions. So it's just a really appropriate way, it felt, to kind of display to the guys watching here about really just what the difference of 10 days can make with some of these individuals. So to wrap up, for any of the clubs or coaches who are watching this, who want to find out a little bit more about how to get involved or how their facility can start to offer rehab programs in the local community, I've drilled into some super easy steps, which breaks it down for the guys. So just super quick, top to bottom. As we've explained, the program runs completely online, was built so that it could be delivered in the gym, at home, outdoors, online.
Yeah.
Your independent gym members will receive 25% discount off CAWS Club memberships automatically. They just need to speak to you or speak to us directly to receive that code, and we'll organise that for them right away. A contribution from every monthly CAWS membership goes into a pot that funds projects for vulnerable groups, or into research which helps to support rebuilding the fitness industry, which is in conjunction with our work with UK Active. We talked about this a little bit before. On average, trainers and coaches take about 30 to 45 days to complete the rebuild program. In reality, it's probably going to take them about 90 days to feel fully confident and for it to be embedded in their coaching practice. But as we've mentioned a couple of times, by the time they're around 10 days, if any of your staff or if you're going through the program, you'll have gone through the key fundamentals of the damage that COVID causes and the impact it has on an individual. So by that point, you'd be pretty confident to have some of those conversations in the local community, and for want of a better description, start prospecting the fact that the rehab program is coming. We talked already that what the guys want to price that at is entirely at their discretion. As we said, they'll be listed on the CAWS registry graduates. Most that complete rebuild will then jump on to Fortitude. There is the rebound program is also in the membership as well, and some people will dip between the others, but for obvious reasons, as we talked about, rebuild and Fortitude speak to each other well. We deliberately set this up as a membership model. Because of the nature of the content, there's going to be new content and research that emerges all the time. So we wanted to create a course that was live so that we could continue to add in the updated content, and so that none of the guys watching this would go through the content and then for it to be outdated. So that's partly why the membership model exists. It also means then that you can retain, as a learner, access to all the content anytime if you need to refer back to it if you're working with an individual, and attend any of the live Q&A sessions with Carl and any of the team on an ongoing basis. However, the membership model also means that if somebody wants to sign up for a month smash the course out in a month and learn it and then cancel with us, they can do that as well. So kind of there's absolutely zero minimum terms or obligations. We wanted to make it as flexible as possible in any case, but also in light of the fact of the current situation and the current financial situation that everybody's enduring as well.
Excellent. So they can jump in and out as new stuff comes up if they need to?
Yeah, they can do if they want. Yeah, so that, yeah, they could do a couple of months, leave us for a couple of months, and then if we've added a new course and they fancy that, yeah, totally to be kind of pick and go, really.
Like it.
Does that all make sense?
Just to me, yeah. Sounds interesting. Sounds very useful. Sounds very worthy as well. I think it's probably the way of putting it. Something that, as a nation, we almost need to help and come together with these things. So, if this can upskill some of the trainers or trainers around the UK to get on board, then even better. Fantastic. Definitely, I think that's key, isn't it? It's getting word out there that creating the connections, isn't it, between the people that need the help and the people that can provide it. It's only public knowledge that's going to help do that. So,
thank you, and with the help of people like you guys, who are helping to drive awareness and let clubs know that this is available.
Yeah,
if they want to get involved.
Yeah, well, hopefully the guys in the group will see the value and jump on board and take advantage of the discount and take advantage of the opportunity. So,
thanks, mate. Are there any more questions? Any more questions from you?
No, I think I understand it all. I think it's pretty clear what it is, and we'll just on the video we'll put a little link to the site and how they can jump on board, and yeah, all good.
Thanks, mate.